Today, I want to talk to you about pregnancy low back pain and how you do not have to live with it. So, I'm going to tell you a story about one of our patients named Amanda, who recently came to us with her pregnancy low back pain. And it's really to highlight that there are things that you can do and you can take control of how your pregnancy progresses and what you're doing through it. So we hope to highlight that for you. So pregnancy low back pain is super common. Research has shown that anywhere from 20 to 72% of women will report some type of low back or pelvic girdle pain during their pregnancy. And of those women, 30 to 50% of them report pain severe enough to lose time off from work or to avoid social situations. So not only are women dealing with pain, but that pain can be so bad that they have to take time off from work and they're avoiding hanging out with their friends and family and doing fun things, enjoying their life and enjoying their pregnancy. And that's a pretty big chunk of people that have to do that. Now, what I think is one of the saddest stats is that of those women who are reporting their pain to their physician, so they're telling their doctor that, hey, I am dealing with low back pain with this pregnancy, only 15 to 30% of those women are reporting that they get any type of advice as far as any type of treatment that they should receive. That is a very low percentage. So women are talking about it with their healthcare providers, and unfortunately, it is getting written off as this is normal. So this is why I wanted to come to you guys with Amanda's story today. So Amanda came to us when she was about 3 months pregnant with her second child. And she was having right-sided low back pain that she said it was achy all the time and it would get sharp when she did certain movements, especially like getting up and down from sitting, rolling over in bed, or when she would get down on the floor to play with her 2-year-old. So she said that with her first pregnancy, she didn't have this type of pain. She had a little bit of mild low back pain in the last month of her pregnancy, but it went away once she gave birth, and it was nothing like the pain that she's experiencing now, which her pain currently was pretty constant with the aching, and then she would have sharp pains with any of those movements, and it would just make it hard for her to kind of get through her day-to-day of taking care of her 2-year-old and doing the stuff that she needed to do around the house and that. So, and she said it was getting worse, and so she went to her OBGYN for her normal monthly appointment for her pregnancy, like everyone does, and told her doctor about her worsening low back pain. And unfortunately, all he said to her was that you're pregnant, it's normal, this happens, and there's nothing you can do about it. You just have to live with it. So she left extremely discouraged because here she was only 3 months into her pregnancy, and she has a 2-year-old at home that she has to take care of, and she is miserable with her low back pain already. Thankfully for Amanda, she had a friend who had come here as a patient of ours during her pregnancy, and her friend told her about how pelvic physical therapy helped her relieve her pain and kept her moving and exercising the way that she wanted during her pregnancy. So we are eternally grateful to that person because she referred Amanda our direction, and Amanda gave us a call, and we were able to help her out. And in Amanda's case, all that was really needed was some simple changes in how she moved and some education in some different stretches and exercises to help her free up some kind of tight 10-step muscles. And with that, Amanda was able to get rid of her pregnancy low back pain and finish out the rest of her pregnancy feeling strong, healthy, and ready to deliver. In Amanda's case, it was a few simple things that made a change. Now, everyone's case is different, but it's worth a try, and it's definitely is better than doing nothing and having the pain getting worse and feeling just kind of hopeless and deflated that you're just stuck with it. Okay. We hear too many women say, well, my doctor said it was just normal. I just have to deal with this. There's nothing I can do. And they just get less and less active, and they're doing less and less things that they love. And their pregnancy becomes miserable. And so that's where we want to come in and help out. So Amanda is a clear case of where you may need to advocate for yourself as a patient. Your doctor, your nurse practitioner may not make the recommendation that you should do anything about your pain. They may just tell you that it's normal. It is not normal. Pregnancy low back pain is common, but not normal. You guys have heard me say that phrase before for many things, and I will continue to say it till the day that I die. But pregnancy low back pain is common but not normal, and there's things that you can do about it. So if you are dealing with low back pain like Amanda was during her pregnancy, you may have to advocate for yourself and ask for a referral to physical therapy to get the help that you need, okay? This is not something that you just have to deal with and suffer in silence. It's also important that we alleviate pregnancy low back pain as quickly as possible, not only so that you can have the best, most comfortable pregnancy possible, but also because persistent low back pain during pregnancy can have long-term consequences. So there was a study done where they followed women 12 years after their delivery. And then this follow-up study, 86% of the women who had had back and pelvic pain during their pregnancy reported suffering from back pain when not pregnant. So if you have it during your pregnancy, there's a good chance that it can happen or stick around afterwards or come back later on in life. And we don't want that to be the case. We want you to be able to move and do what you love and not be dealing with back pain. It is very important that we alleviate low back pain during your pregnancy so that you don't have issues later on in life with back pain, because there's a study that followed women 12 years after delivery, and they found that 86% of women who had back pain or pelvic pain during pregnancy reported suffering low back pain when not pregnant. So we don't want this to be a persistent problem. So what can you do? If you are dealing with pregnancy low back pain, we don't want you to suffer in silence. We can help. And there are many people out there who want to make sure that you are dealing with a pain-free pregnancy and able to do the things that you want during your pregnancy. So we especially created a ebook here, and that's 10 simple tips to ease pregnancy pain, so that we can offer some assistance to people to get them started to having a more comfortable pregnancy. So if you are dealing with pain during your pregnancy, what I want you to do is download our ebook. So I'm going to put in the comment section, just simply comment "me please," and I will make sure to get you a copy of that ebook about alleviating pain during your pregnancy so that you can get started.